Welcome to this explainer. Okay, if you're one of the millions of people dealing with that dreaded shooting nerve pain, just the thought of cramming yourself into a tiny airplane seat or, sitting behind the wheel for a cross-country drive, it probably sounds like absolute torture. But hey, take a deep breath. Today we're focusing on exactly how you can manage lower back and leg pain while traveling so you can actually, enjoy the journey.
It's totally normal to look at an upcoming itinerary and just feel this wave of anxiety about potential flare-ups. You might be wondering, does chronic back pain really have to ruin my travel plans? And the answer is absolutely not. With the right prep, you can totally keep moving comfortably. So let's dive into this and see exactly how you can outsmart your symptoms.
Here's our roadmap for today. We'll cover understanding sciatica and travel, smart packing and trip prep, tips for the road, navigating flights and trains, essential stretches and movement, and finally, safe arrivals and red flags.
All right, Section 1, Understanding Sciatica and Travel. Let's get into why traveling can be such a trigger.
So, it's actually incredible to think about the sheer scale of the sciatic nerve. It's literally the longest nerve in your entire body, and when it gets irritated or compressed, well, it triggers a very specific mechanical reaction. We're talking about that shooting, burning, or tingling pain that radiates right from your lower back, straight through your hip, and all the way down the back of your leg.
And often tied really closely to this is something called piriformis syndrome. Your piriformis is this deep buttock muscle. When you're locked in a car or a plane seat for hours on end, especially if you're the kind of person who tends to sit with crossed legs, that muscle just tightens right up. And when it does, it compresses the sciatic nerve right underneath it. So basically, prolonged sitting just pinches the nerve and boom, triggers a flare-up. Section 2, Smart Packing and Trip Prep. Because beating this actually starts before you even leave the house.
To win this battle, you absolutely need an easily accessible carry-on toolkit for when that pain strikes. Make sure to pack disposable heat and cold packs along with some topical pain-relieving gel. You'll also want to keep your prescribed or over-the-counter meds right in their original bottles for smooth security checks. Oh, and roll up a small towel. It makes for fantastic instant lumbar support. Most importantly though, wear supportive shoes. Seriously, even a tiny 5mm difference in leg length from bad footwear can set off a flare-up.
Now, how you move your gear is just as important as what's inside it. A really poor habit? Hauling one massive, heavy, two-wheel duffel bag or suitcase that forces you to yank all that weight behind you. Instead, the smart move is to split your stuff into two smaller bags with four-wheel spinners. Those four wheels let you steer the bags with a tall, supported posture, which totally prevents those painful twisting and pulling motions. Oh, and whenever possible, just use curbside check-in and avoid the heavy lifting altogether.
Section 3, Tips for the Road. Let's make sure those car rides are comfortable.
Okay, before you even put the car in drive, you need to optimize your seat setup. First, move the seat forward a bit so your knees stay bent. You really want to avoid locking your legs. Next, raise the seat height so your hips are sitting just slightly above your knees. This helps maintain a natural neutral spine. If your car allows it, tilt the seat downward to ease lower back pressure, and then recline just slightly. That takes the stress right off that sciatic nerve.
And here is a golden rule to live by on road trips, the 60-minute rule. Basically, stop the car every single hour. Just get out, stand up fully, and walk around the vehicle for maybe 2 to 3 minutes. Don't wait until the pain becomes a sharp, intense burn, right? Getting ahead of it with regular movement literally stops the pain from building up in the first place.
Section 4, Navigating Flights and Trains. Let's talk about surviving confined spaces. So, not all seat cushions are created equal, which means you need to choose your travel weapon wisely. Honeycomb gel cushions, fantastic for the office, car, or wheelchair because of their open cell cooling and pressure distribution. But if you're flying, you might want to grab an inflatable cushion instead, since it easily deflates to slip right into your purse or backpack. For keeping that natural spinal curve intact in a car or plane seat, a Mackenzie lumbar roll is a total game changer. Or if your pain is localized right at the tailbone, go for a coccyx U-shaped cushion. The ergonomic cutout takes the pressure completely off your spine.
When you're booking your train or flight ticket, definitely try to grab an aisle seat if you can. This lets you slide your leg out and get up without climbing over anyone. And I absolutely love this piece of advice from Dr. Robert Hayden. He says, not to be shy. Communicate with the cabin crew. They've seen people with this condition before, and if they aren't busy serving, they'll usually let you do a couple of stretches in the galley area.
Section 5,
Essential stretches and movement.
Let's run through some really handy, travel-friendly stretches. If sitting is hurting you, try a standing back bend. Just gently arch backward with your hands on your hips to counteract all that forward posture. If you're stopped for gas, use your car's bumper for a hurdler stretch to loosen up tight hips. Stuck in your plane seat, seated nerve glides work absolute wonders. Just extend your leg, point your toes away, and then pull them back towards you. And finally, the seated figure 4, where you cross your ankle over your opposite knee, is amazing for stretching out that tight piriformis muscle discreetly.
And while you're doing all this stretching, please stay hydrated. I know, it sounds almost too simple, but drinking water literally keeps your internal tissues hydrated. This makes it infinitely easier for your muscles to move, glide, and stretch, which is huge for reducing stiffness and inflammation during your trip.
Section 6. Safe arrivals and red flags. We made it to the destination, but we aren't done yet.
Okay, a huge mistake people make is arriving at their hotel and immediately collapsing into a squishy lobby chair. Don't do it. Follow this post-travel protocol instead. Step 1. Walk around for several minutes before you even think about sitting down again. Let your natural stride loosen your hips. Step 2. When unloading your bags, make multiple, smaller trips so you avoid any awkward heavy twisting. And step 3. If your lower back feels freshly aggravated from the journey, go ahead and apply a wrapped cold pack for about 20 minutes to calm things down.
Now, most travel flares are a pain, literally, but they aren't actually dangerous. However, you do need to watch out for a few serious red flags. We're talking about sudden numbness or muscle weakness in one leg, any trouble controlling your bowels or bladder, pain that follows a violent injury or a fall, or if your symptoms are worsening and accompanied by a fever. If you experience any of these, you need to skip the stretches and seek medical advice immediately.
And on that note, just a quick reminder that what we've covered today is general educational information. It is absolutely not a substitute for personalized medical advice. Having a quick chat with your doctor or physical therapist is for sure the smartest first step in your trip prep. You just want to make sure your specific travel plans are safe and optimal for you.
Because ultimately, sciatica shouldn't steal the joy of discovering new places from you. By packing smart, utilizing the right cushions, adjusting your seat, and keeping those muscles moving, you are taking the control right back from the pain. So, with the right preparation, keeping your symptoms at bay, where will your journey take you next? Thanks so much for joining me on this explainer, and hey, safe travels out there.